Good morning, YouTube. So I'm back and I want to talk about the treatment that I started receiving for the LGL. So the first thing the doctor told me was that we have to find a way to raise your white blood count. So how you raise the white blood count quickly is to start on what they call a colony stimulator for the bone marrow. And what that consists of is something like a Neupogen or Nivestum. It depends on what your insurance covers. And the doctor wanted me to get the Neulasta, but my insurance covered the Nivestum, which is like a different brand. Of course, it's the cheaper one, but it was what they would cover for my neutropenia, because my case was severe, because once again my white blood count was just 120. So the doctor, when I had my doctor's appointment, he brought me in. And let me turn on this light here. Oh yeah. Okay, so he brought me in and he had a nurse come in and they showed me how to load up the syringe and how to give myself shots in the stomach. I've never I've always been scared of needles. Oh, let me tell you. So this was a turning point in my life. But I had no choice because of my white blood count being so low. And of course, everybody knows that your white blood count, your white blood cells is what helps you fight an infection. So I definitely need to get that up and follow his direction, being scared of needles or not. Okay, so I had to start taking it 3 times a week. So I had to give myself a shot in the stomach 3 times a week. So about the second week after giving myself the shot, so it would be something like Monday, Wednesday, and Friday. So after about the second week, I started having bone pain, but it got so bad that I needed help to stand up. So if I was sitting, I needed help to get up. So I had to start using a cane. That's how bad it got. Um, it would last for about 2 days, and I had the time when I had to go to the bathroom, meaning I couldn't wait. So normally it take me a couple of seconds to get there. Once that, I guess the Nivestum, once it kicked in, it took me a couple of minutes to get to the bathroom. And I'm talking about just standing and just walking to get there. I felt like a 90-year-old person whose bones crack. That's for people who've been around older people. And a lot of times when they get older, it's hard for them to get up. Their bones crack. They move really, really slow. They might need some help. Well, that was me. Okay. So I go back, I tell the doctor, and he's like, oh yeah, I forgot to mention. But I really just think that he didn't tell me because he could tell that I was still in shock. And sometimes when you get a diagnosis like this, I think a lot of people, it's a hard pill to swallow. And trust me, it was a hard pill for me to swallow also. And when you have a hard pill to swallow, you get a little apprehensive, especially if you're not a person that takes medication. But once I told him, he said, oh yeah, it does cause bone pain. Oh my goodness. So after taking that for about 2 months, because of the neutropenia, that's something that I'm going to have for the rest of my life. Then they had to put me on a medication where it would control that on, I guess like maybe it would control it all the time, and where I wouldn't have to take the shots, because the shots really was just to see if it would actually elevate the white blood count, and it did. So they would use that in an emergency. Let's say if I got an infection, I was in a hospital or something like that, then they could use the shots to elevate my white blood count. So now we know what's going to work in a snap. So now we need something to maintain my neutropenia, which the go-to medication is the methotrexate. So the methotrexate is going to help with my white blood count, and it's going to also help with the rheumatoid arthritis. What I didn't know, but after reading, some people who have the LGL, which is very rare, so they have RA with it also. And I don't think I've ever said it in my other two videos, but less than 1,000 people a year are diagnosed with LGL. So it's very rare, and it's one of those things that's a little complicated to diagnose, because remember, I thought it was the tripad, the Felty's disease, the tripad of the RA. And I think the doctor thought that that's what it was too, because it's the same symptoms. So we start on the methotrexate, and I went from 2.5 milligrams a week up till 10, and it's a process. So the process is you start off taking the 2.5 milligrams until you reach 10 weekly. Well, let me tell you, the first time after taking it, I was nauseous, I didn't feel well, and I needed to go lay down, because that methotrexate, it makes you sick. So I had to gradually increase it up until I was at 10 milligrams. Once I got to 10 milligrams, then I started noticing a change. But during that time, you still have to go get your monthly blood draws done, because they still have to make sure that your white blood count is where it's supposed to be. So after taking that, probably I want to say about 4 months, I started really noticing that I was tired all the time. I would get up, I would be so tired. I only could do a little bit at a time. I would have my little coffee, maybe make myself a little breakfast. And then I found out I had to go lay back down because I was so tired. So to combat that, they told me to start taking vitamin D and folic acid. So folic acid is supposed to help with the side effects of the methotrexate. And the folic acid, yes, it did help. The vitamin D, I really can't tell the difference, but they tell a lot of people with an autoimmune disease to take, vitamin D. But I haven't noticed any difference with it, but I take it. Maybe it's doing something and I'm not sure about it, okay? All right, so because I have the RA, I needed to go see the rheumatologist. So I'll have to tell you about the rheumatology and the different things on how the LGL plays into the RA, because it seems like it's, combined. I'll have to talk to you about that during the next video. But thank you for listening, and I hope when I come back, I could be a little bit more interactive, give you guys a little bit more detail about the LGL, because it is so rare. It's so hard to find things on the internet or YouTube because of the fact that it's so rare. So I'll come back and hopefully I'll have some more information for you, because what I do is I think about what had been going on with me, what's going on with me, how the process went, and I have to really think about that to get my thoughts together. But I do appreciate you guys listening, and have a good day. Bye-bye.